another Holy Spirit inspired function of this channel will be to help people with autoimmune diseases. In trying to figure out what's wrong with me the best I can. I mean, my first love was medicine. I just like a force protection, and I care about my country more. So I started the path in the military, and I just continued it. Like I told our housing people, some of their numbers are not adding up for our voucher, and they kind of disenfranchised us from the family self-sufficiency program, and which would have been helpful now that they want us to pay $3 of our rent. I mean, that seemed like a big deal to anybody else, but the fact of the matter, my health and all the complications with that, plus the fact of my age, I'm not 30, and my higher level degrees, more than one. So, it's select stuff that I can do and select stuff that people will even consider me for. So, my employment future is very complicated, which is why I have so many businesses. More than one on paper. One already registered as a LLC, and then others that are, in the project phase. Because it's better if I work for myself, and I've always had one sitting in the back burner as a consultant. But as long as people are targeting us, and messing with us and doing stuff to us that, sabotages us doing anything, or they keep us spinning our tires trying to meet requirements for this rule or that rule, or to make sure we get medical care for this and that, and making sure that everything is set for my daughter's education. And as long as we're spinning our tires, doing paperwork because people retaliated against us from this agency or that agency, it keeps us spinning our tires. Then we can have agencies say, well, everything is so bad for you, we'll just take it away. That solves nothing. All it does is show that people are involved in it. That's all it shows. And the fact that nobody will put anything on a police report. Nothing. Unless it's a police report that's geared against me. But so this situation has turned me into, also for my children, and I mean, I've always been a medical researcher, looking at symptoms, testing, and then going to NIH or CDC or some kind of medical research database, to find issues. But now I do it all the time because the VA has done very little. What they do is, if I can, fight and scream, figuratively, and send papers and serve people and send emails and make phone calls, maybe I'll get, this kind of radiologic examination or a couple of blood tests here, and everything stops again. All the while that I get more and more and more joint destruction, more and more joints that are coming out of socket, now all the way up to my shoulder. At least it's only one shoulder, but unfortunately it's the one I write with. So, one day is good for us, one day is bad. So I figure that for everything that's happened to us and all the stories I've heard, I listen to stories from others who have been targeted or had human rights violations against them. Most times, they've done nothing wrong in their life. And sometimes, a few people I've talked to, they've made mistakes, but they repented of them. they tried to make amends with, the state, or if possible, with whatever they did. They stole from somebody, or they um, damaged their property, or they got in a fight with them, or whatever. But, you can feel true repentance when you're in its presence. Doesn't mean people are not going to make mistakes again. Some people are wired for mistakes. So just like Jesus said, it requires extra fasting, extra prayer, extra determination to remove that evil that's infected their mind and their soul, so that they can move past it. The sacraments, they are the great grace that is given to our soul and to our body and to our mind. And some people have never encountered them. And some people have been told that, yelling and screaming at church, or handling snakes, or fasting for days and days and days, and, clapping and staying up all night in worship and praise sessions, these are sacraments. Although these may be fitting, they are not sacraments. So we'll just use this channel to help others. Now, there's something that I encountered because of what happened yesterday. When I was pulling a cart, and all of a sudden I grabbed my hands, and I had my hands were purple and white, literally purple and white. And this has happened on and off for several years. And I asked my neurologist about it. I mean, I love the guy, and I'll never know if he was just in a hurry, or if he only wanted to do surgery on me. That I was his surgery fix. I mean, because I really liked him, as a physician, and he listened, and I think the problem was too many office wives, and I'll still stand by that. Once he started having tons of LPNs and scribes, as they call them now in Saginaw County, come in with him, then I noticed the care started to change. And it's the same with the VA. You got the MSAs, they have to interject themselves in everything. And then you got the LPNs. Certain LPNs are very friendly with the MSAs. And sometimes they go back and forth. Some MSAs are LPNs, not all. And some of the MSAs and LPNs, they will switch jobs. I've caught at least one or two LPNs and MSAs. I remember their voices, I remember their mannerisms, I remember their faces. They'll switch badges. But anyway, that being said, from yesterday, what happened was I had Rheynauds phenomenon, which is generally, it's not Rheynauds disease, which can be dealt with through, diet, lifestyle change, etc., to get rid of those spots. It's when your hands have different spots. It could be, a joint up, or it could be an entire finger, or it could be an entire hand, or it could be spotted. Some people, you can't see it here. I don't really have them right now anyway. You can't really see it. You can see it there slightly. Now, when your hand's like that, back in the day, you could see it kind of there. See how it got red and white spots, the skin, under the skin? Back in the day, they called those liver spots. Those are not liver spots. Those are called Bier spots. Bier spots generally are of no concern. They just show that there may be some kind of blood flow problem. And that's like throwing a dart up on a wall. No dartboard, just a wall. Lots of stuff affect blood flow. Lots. So generally they're not of concern unless they're associated with insomnia, which would apply to all you folks, such as myself, who have a sleep disorder, and tachycardia. Now, tachycardia, you got to watch at some hospitals, and even at the VA, they don't care. So they won't give a good range for your heart value. And I've seen also this with oxygenation, and it ticks me off. If somebody has varied oxygenation, it's important to write down the range. But sometimes people don't, or they just have a bad attitude. They'll write the highest. I've seen more people write the highest then I have people seen right the lowest. And now if somebody is, over the course of a minute is going from 93 up to 96 or even 98, it would be a concern. Over the course of a minute, they're going up and down, up and down. Oh, we'll just take the 98. Wrong answer. You should put the range there. If you look at it for 10 seconds and somebody is, they got 95 once, 93 once, they seem to be sticking up there with 93 over the course of 9 minutes or 5 minutes. That's probably okay. Or 3 minutes, probably okay. But if the range is going up and then coming back down and then going back up, and they're not eating or drinking or hyperventilating, actually if they're hyperventilating, it should be more prone to be going up. If it's not, respiratory problem. But again, unless hyperventilation involves asthma or any kind of anaphylactic reaction, I'll say that. But or an anxiety or panic attack, that would also, those have been known to decrease oxygenation and restrict the airway. But anyway, you get the point. But your tachycardia is 100 plus for an adult who's in resting. Now, resting means you're sitting for at least, I think it's 2 to 3 minutes. You should be sitting. That's a resting position. Or laying down. Now, keep in mind, though, some people, I can't remember the particular name of the posture and blood flow related pathology. I can't remember the darn name of it. But some people, their blood pressure and their heart will change depending on what position they're sitting or laying in. And I forgot the name of the darn. It's an actual pathology, and it can be really serious because these people, if they have other check boxes like heart disease, blood pressure problems, diabetes, any diabetes, if they have PAD, peripheral artery disease, high cholesterol, hyperlipidemia, high triglycerides, hypertriglycemia, if they have any of those things and they have this particular disease where you have dramatic blood pressure boosts and drops, depending on your posture, how you're laying, how you're sitting. When you sit up, it can actually make you pass out. I just can't remember the name of the darn pathology right now. But anyway, so those kind of things are going to affect your heart rate as well. So your tachycardic rate, my argument is that if somebody is at 90 plus and they have different kinds of, pathologies that are already diagnosed or it's thought that they would have, then my argument is that their tachycardia could possibly be lower because of their problems. And even if somebody was to argue against me, say, no, tachycardia is always 100 plus for an adult who is at rest. But at rest for these people with all of these, problems, it has a different definition. It presents differently. So anyway, I would argue people, if your heart rate is consistently 90 plus and you have insomnia and you have those spots that I showed you earlier, you may have what's called Marshall-White syndrome, which many times presents for people with autoimmune issues. But it doesn't always have to. And then we go to Rheynauds phenomenon, not Rheynauds disease. Rheynauds disease is kind of surprising that it's actually less serious than Rheynauds phenomenon. Now, Rheynauds phenomenon, there's so many things that could cause it that, it's something, a lot of stuff. It could be caused by psoriasis, autoimmune. contact dermatitis, fungal infections, eczema, dihydrotic eczema, palmar erythema, urticaria, hives, follicle. Oh, I always have a hard time saying this. Folliculitis. I always have a hard time saying that. This can sometimes be misdiagnosed as a spider bite or vice versa. Then you got vitiligo. Then you get pityriasis alba. Those are some of the issues that can be related to Rheynauds. Or no, actually, correction. Those are the red and white spots, which can sometimes be misdiagnosed as Bier spots. Now, when you go to Rheynauds, anyway, my computer is running show. Rheynauds many times is connected to autoimmune. That is Rheynauds. Darn, my computer is not. My tablet's not cooperating. But again, you have Rheynauds disease, which sometimes can be connected to other things, circulation problem, or it could be connected to petechiae. And this is, or purpura, which is common for older people. But you can, darn it. Anyway, so I'll just try to go off memory here, which will be fine. But Rheynauds, that's Rheynauds syndrome. Now, Rheynauds phenomenon could be connected to Hanak, Schonlein purpura, or actinic purpura, and Rheynauds is generally caused by stress or by, getting your hands or even feet, generally hands though and arms, they get too cold. And the same with those others that I just mentioned. But now, when you're looking at that's Rheynauds disease. I'm trying to get back to Rheynauds. All right, now Rheynauds syndrome. All right, now that's actually no, not Rheynauds syndrome. Let's move away from that. Rheynauds disease. Rheynauds disease is common, and it can have many other causes. Now, Rheynauds phenomenon, on the other hand, that's the one that is usually secondary to another illness. So it's kind of like connected to, or idiopathic. It's connected to that particular, I think that's the right word, idiopathic. It's connected to another medical problem. Rheynauds phenomenon is. Rheynauds disease is different. That's what can be actually be treated through lifestyle, less fatty foods, more vegetables, less alcohol, stuff like that. Medications to control the cholesterols, stuff like that. But Rheynauds phenomenon, as I said before, is always connected to another issue. It could be connected to autoimmune many times. So if your fingers are, remember the spotting, those are Bier spots, but if your fingers, like big pieces of your fingers, are discolored, and that's kind of a not really a good example, but kind of getting there. See the differences in color? It's not a great example. Some days it's worse. I call them my swelling days. You see the tops of the fingers are more purple, and then you get light, and then you get down the lower knuckles where it's more red. Like I said, it's not a great example today. But sometimes I look at my fingers and the tops of them are purple, and the underneath, the lower, the bottoms are white. That is Rheynauds phenomenon, as I said, or called secondary Rheynauds. And that can be a problem because it can cause cell death in your hands. And if you have carpal tunnel along with this, it could be very destructive, which, like I said before, is why sometimes my hands are purple. Now, it could be related to the carpal tunnel, but being as my situation, it goes all the way down to my elbow, some of these discolorations, so it's not only connected to carpal tunnel, it's connected to something else. And the fact that it also happens in my hand where I already had carpal tunnel surgery, that also kind of, tells us that it's not. It's, related to something else. But these are, more signs that you have autoimmune, and get a video of it, or have somebody else look at it, take a good picture, and then have them give a witness statement. This is what's important for veterans, because the VA, they never believe us. At this point, I don't like the VA, And as I've said before, I don't sit with any party anymore. I don't worship any hero that sits in any office or any desk. None anymore. I'm too old to fall into hero worship. I put my mom got rid of my comic books a long time ago because I grew up. So I'm not gonna let anybody influence my thinking except the Lord and his ministers of the altar, or his ministers, because of consecration. And I've lost a lot of hope in the VA. I used to be one of those guys that used to try to find every possible rational reason for somebody's bad experience. I don't anymore. Not anymore. And housing vouchers are a great thing, but now I'm finding that people are even weaponizing housing vouchers. I don't know what's happened to this country. And you can't, like I was discussing with somebody on the bus, we can't blame our problems on every 4 years, And we can't, have administrations that don't want to be responsible for fixing things. All they want to do is blame the previous one. Or blame the previous one because they were 8 years. I'm so tired of that. Or blame the previous one because they were an ineffective presidency. I'm so tired of it. There's no honor in politics anymore. Because many times nowadays, not every time, but many times politicians are thieves. And they live very well. While we don't. And when you take billionaires who go into politics, I like to see them give away significant parts of their wealth. There's nothing wrong with making money and being a capitalist. But when you have so much obscene, disgusting wealth and others, people that I've known the past 8 years that I've encountered, or people even that I knew that, people talked bad about them because they were contractors like me, but we're the bottom of the totem pole. We're only making 3 or 4 times what people in poverty are. We're not making big money over there. Now our managers, our captains, our project managers, oh yeah, they make a lot. But even people that make more money than them, those are the people that they sit on the boards. And some of the companies that I used to deal with, they have 10, 15, 20 people who sit on a board, and they all draw in anywhere from 2 million to 15 million a year for telling other people what to do. Which, yeah, that seems the American way, except they're so far removed from the people that they lead that they don't know anybody's name at all. Not one person. Is that really leadership? I don't think so. But anyway, I'm getting off topic here. But my concern is that people that have Rheynauds phenomenon, secondary Rheynauds, or people that have Rheynauds disease, that they get the right facts. And that people that you're battling with, like Social Security or the VA, over an autoimmune condition, and you, your partner, your spouse, whatever, you research and research and research. And, don't just jump out on Google or not, correction, don't just jump in YouTube and watch a couple of videos. When I do my research, I go to primary sources, NIH, medical research, Mayo Clinic, Google Scholar. I go to all those sources. CDC, National Science Foundation, U of M, and then I jump in the library-based databases, Science Direct, Pro something. That's another library database. I'm trying to remember all of them. There's a lot out there. And I mean, if you're, some schools let alumni access databases. Unfortunately, my schools, they do not. Not that I know of. But just try to research wherever you can. There's stuff out there. You may only be able to grab a citation, but even if you'd have no memberships anywhere, and you're just using normal old Google, at least you'll have a citation. It's something you'll be able to read the abstract, and you'll know the citation, who printed it, who published it, what time, and who was involved, and what it's about. You'll be able to get that from a citation, which is it's a starting point. But research. That way, you can take this stuff and give it to specifically for veterans or for people, battling over Social Security, and you can give it to these people and put it on their desk. And if they ignore you, like I've had many times, people say, just put it in the trash. I'm not going to read that. I've had at least one or two doctors say that. But they won't read my medical history. You got to follow through and you got to pay attention to everything. Which is why it's best if you have an appointment, bring someone with you. That way you have a witness. And if the doctor or whatever provider, tries to pitbull people out, say, look, it's my right to have somebody present. And it is. It's your right to have somebody present as a witness. Nobody can tell you that it's not. And you can, if people say, well, we only allow only the patient and the doctor, or the patient, the doctor, and nurse, you can say, then I'll be filing a complaint against your clinic, because it's my right to have a witness there, not just your witness. This is another benefit that's come out of the Me Too movement. It's your right to have another person there as your witness, not just a doctor and their nurse or their PA. So, even some medical procedures, some. At a minimum, if it's an OR, the vast majority of ORs have an operating theater above. So, I want to say vast majority. That would probably be mostly teaching hospitals. But ORs do have to have a videographic record of what they do. I think. Don't quote me on that. I think they do. But, just keep fighting and researching. And, I hope that this video about Rheynauds secondary phenomenon and Bier spots, possibly help somebody out there.